time. So I don't think we need to do that. So in want of me trying to dig up the minutes, can somebody tell me what the next agenda item is on the minutes or on the agenda?
Next thing is me.
Okay, great. There we go. So I'll turn it over to Dr. Monty. Thank you.
So we have a special presentation for you today. As I hope you all saw, and I emailed you earlier this week was the first year anniversary of our inaugural Behavioral Health Bureau. And so I've asked Dr. Julie Gary, who is the Bureau Chief, to come and present and let you know what they've been up to for the last year, talk to you a little bit about what they've got going on moving forward, and then give you an opportunity to discuss and have questions. Thanks, Julie.
Can everyone see my slides?
Yes.
Yes.
Yeah, we can see them.
Okay, good morning, everyone. I've met a lot of you. For those of you who I haven't met, my name is Dr. Julie Gary. I'm the inaugural Bureau Chief for Behavioral Health for the City of St. Louis, working with Dr. Monty on this important topic with a brand new team. It's super exciting. Some days it's challenging in terms of people we're interacting with. Other times it's challenging in terms of resources, but super excited to take on this opportunity with an amazing team. And I'm going to talk to you a little bit about what we've done in the first few months. So we're going to talk a little bit about vision, mission, priorities. I'm going to just briefly show you the team. We're going to talk about initial progress by program, next steps, and then I'll be open to your questions. So when we started this, for those of you who were at the launch, this is the vision and mission that we put together with the CDC OD2A team, kind of doing a team exercise with our current team members, and then working with Dr. Monty on kind of tailoring it. I think Corey, who's on the call, also had some input on that from an equity perspective to make sure our language was what we wanted it to interpret or what we wanted to message to the population. So vision, pursue the holistic healing of St. Louis families and communities by overcoming obstacles to them experiencing their highest optimal mental health and well-being. And then mission, strengthening relationships, resources, and action with community partners to promote awareness, availability, and equitable access to culturally competent behavioral health options. And the pictures shown here are actually from two of those community partners. The one on the left is Places with People. They have some great quotes throughout their building. And then the second one is, it's art by an artist named C. Bobby. He's a local kind of equity artist. And this is actually the van that the T uses when they do some of their outreach. So moving on, looking at our priorities, and these are things that Dr. Monty and I have talked about kind of for the next year, and we'll go into a little bit more detail at the end, but my team has doubled since I started. So I started with three employees who came from other parts of the department or who were returning to the department. And now I have 4 new people, and we'll be adding a couple more here in the next few months. So the most important piece of that is we're building something new. So we want to hold on to those people. We're spending a lot of time training them and resources training them. And so we want to build a strong and positive team culture so that they feel positive about their workplace. They're happy. They're all working together well. And so we're spending a lot of time on that. Another piece, and kind of these next 3 things go together because they overlap on a daily basis. So we want to link people to care. We want to educate and train our community partners and citizens, and we want to do outreach. We want to meet people where they are in the community. And so those are our priorities kind of as we started the Bureau, and they continue to be our priorities going into next year. All right, so quickly just meeting the team. I'm just going to go through by section. So the light blue are our public health educators, Tammy McDeal and Denero Mack. We have a secretary, Samaya, who's a former public school teacher. She's been a great addition to the team. In gray is our education and training team, Elena and Sam, who are new to the department. In darker blue are Anastasia Wright and Alexis Zahuranek, who are our criminal justice team, getting pretty active here as things are going on with the jail. And then our epidemiologist, who's on the epi team, but she spends a lot of time with us every week, is Megan Clark. All right, so now let's look at what probably matters to you the most, our initial overall progress. So call volume, we have a main number to the Bureau. When we first started, we were getting about 10 calls per month. Now we're getting 20 to 25 per month. And that includes calls from other city departments. So other city departments are interacting with citizens, seeing us as a resource, reaching out to us for us to work with citizens on their mental health challenges or to connect them to community resources. We also, and that includes walk-ins as well. We actually had someone walk in yesterday and spent a couple hours with that person trying to connect them to what they needed in the community. In addition, every staff member has received at least 10 mental health and substance abuse training courses, and 3 of us are peer recovery support certified, meaning we've gone through a 40-hour course with the state. We've taken a certification exam, and we are certified to work with people who are having challenges around recovery. And there are kind of some cultural competence, language pieces to that. There are resource pieces to that. So that was a great training for my staff to go through. We've also handed out more than 800 doses of the overdose drug naloxone or Narcan. So we're doing a lot around that. We're going to be doing a city-wide training around that coming up. And we've also done 2 education pieces around that. We did something for coaches at a local community center, and then I did something for another school requested like a cheerleading squad to get Narcan training and to have it handed out to them. So we did that as well. We've participated in more than 50 community outreach events, and our requests are kind of through the roof on that. So we're being selective about where we go and what we do. We obviously want to make high impact. And so we're going in the places in the city where we feel like we can have a high impact based on rates we're seeing in those areas. When we talk about education and training, our first education program
Sorry, Julie, can you go back one and can you talk a little bit about the people that we funded in the community?
Yes, so we have 3 sets of RFPs that have gone out. One of them is, the first one was the Overdose to Action funding, and that resulted in about $275,000 going to 5 community partners. And then we have 2 other sets of contracts that are going through the city contracting process right now. One of those is the opioid settlement funds, and the other piece are the ARPA funds. So we have 2 more sets of funding that will go out to our community partners who are doing that grassroots work in the community. Okay, going on to education and kind of what we're doing and some examples of some of the great work my education team is doing. So the first set that we did was for Community First Summer Camp, which was a summer camp for ages 11 to 14. That Community First is an organization under Grow STL. And so we went out and did a couple classes for them around mental health and puberty. We also have had an initial meeting with the St. Louis City Public Schools Prevention Council that happened 2 weeks ago. And so we're talking to them about their needs around mental health and substance use education. So that more details on that will be coming kind of as we put that plan together with them. Last week, we held a great journaling event with Harris Stowe. They have an organization called Rewrite. And so they do kind of poetry, vocal arts every week where they read things that they've written. And they reached out to us to provide them prompts around mental health. And then they did presentations. So they journaled about it. And then they did an open discussion on mental health and kind of read some of the poetry that they had written. So I had 2 team members go out to that. Super inspiring. It was a group of about 40 college kids who participated in that event. And we hope to do a couple more events with them here in the fall. And then the last piece of education to kind of highlight is some staff training. So Annie Malone Children's Center reached out to us about doing some staff training on stress and burnout. And so we put together that for them. And we also have something similar planned for our own employees here at the city. All right, moving on to Narcan. I mentioned that we've distributed over 800 doses of Narcan in the community. We do have a plan for citywide employee Narcan training. Our new set of kits should be here by tomorrow. And so we're getting a date on the calendar here later on in the fall, early December, to do that training for our employees across the city, not just in the Department of Health. We've done Narcan training for coaches and athletes. We're in the process of an MOU to do a pilot with the city libraries. And we also will be meeting with aldermen to put Narcan boxes, to provide Narcan boxes, 1 to each alderman, but then also to put them kind of in our high overdose areas in the city. So Dr. Mahdi and I will be conducting those meetings kind of with the first 5 aldermen here in the fall, and then we'll move on to other ones to kind of talk to them about not just Narcan, but how we can better support them in their ward or in their neighborhood in terms of what they're seeing in their with their particular constituents. All right, outreach. Our goal when we started this was to attend at least 2 community events per week. Some weeks we're at 4 or 5. It just depends on the week and kind of the events that are going on in the community. We try to be where we're going to be highly visible and we're going to reach the most people. We started out with Pride back in July, and we've kind of moved through other community events. We're also working on a build grant with Casa de Salud. And so the goal of that grant is to help them develop culturally competent and language proficient mental health materials for their outreach clinic at Casa. And so my employee Tammy, she's been instrumental in working on this. She went to a conference with them, and now we're kind of working through what those materials will look like. But that is a big need in the city as well. We're linking people to care via walk-in, call-in, social media, email, about 25 a month, and we started out at 10. And then there's that RFP number that Dr. Mahdi asked for. So in terms of so far, the OD2A funding, the grants have gone out, and that was $271,537 that went to 5 different community partners who are doing that grassroots work. Criminal justice, Dr. Mahdi will probably update you guys on things that are going on in the jail. My team has been instrumental in some of that work in the last couple of weeks. We are part of the Criminal Justice Coordinating Council, so that's kind of everyone, all the key players in the criminal justice system, talking through things like alternatives to incarceration, linking people to behavioral health resources, which is kind of our role on that council. We're part of the crisis response leadership team. In terms of that, you can see the last bullet there. We have been instrumental kind of in advising the crisis response unit from behavioral health response in how they interact with, from a mental health perspective, people with mental health challenges coming into contact with our police department. We're also in the process of transitioning that crisis response unit to our EMS and fire units as well. And so that will be kind of an across the board crisis response that happens as behavioral health response builds up their staff. In terms of the jail, I worked with Dr. Mahdi to write the scope of work and to put together the new org chart. We've also written job descriptions this week and been reaching out to some providers as well. And then you may have seen some of these if you follow us on social media. We've had quite a bit of social media presence on the Department of Health pages. So my team is young, creative. They use Canva to create things that will reach citizens who are interacting with our social media pages. So it's around things like, what to do to prevent suicide. So there's that visual there, things about overdose, also just things about ending stigma and extending grace and compassion. That's something we talk about here on a daily basis. We all have challenges. It's important to not judge people when we're interacting with them. It's important to extend grace and compassion and to link them to the resources that they need in our city. We've also gotten the dashboard back up in terms of the numbers of overdose deaths. So I work with Megan Clark on that, our epidemiologist, and that's back up showing you kind of the latest data out on our website. And then we just had our first coalition meeting in the last 2 weeks. So we had 28 attendees from 18 community partners that we felt like the big hitters were in the room, people who we know are vested in the work, and we were able to work through some kind of key themes and next steps around our coalition. And our next coalition meeting will be in December, and Dr. Mahdi will be at that meeting with me as well. Based on that first few months of work, we were recognized by Better Family Life at Overdose Awareness Day, and we received the Making a World of Difference Award. So Tammy works a lot with Better Family Life. She received an individual award that day too, but the Bureau was recognized for our efforts to reduce substance use in the city. So that was a pretty exciting day, and we hope to continue working with Better Family Life and the other partners that were present that day to continue to make an impact. Okay, so I talked about those areas that we're going to focus on for next year at the beginning, but I wanted to provide you a little more detail about that. So in terms of strong and positive team culture, we do have a couple weekly meetings here in the Bureau. I also have two-way one-on-one conversations with my direct reports, and I do that monthly with my indirect reports, but obviously have an open door policy as well. I had an employee in my office at the end of the day yesterday just kind of talking about how she's doing since she's been here. So I love that she was comfortable doing that. We're also doing some monthly team building events. We've done a lot of lunches. We actually did a lunch yesterday, some happy hours. We're going to be going to the movies, kind of hitting the aquarium and Ferris wheel that are close to here to kind of continue to build our team environment. Our goal for next year, so we've been connecting about 25 people a month to community resources. Our goal is to connect 50. And I think that'll be easily attainable simply because of our connection with the criminal justice system and some of the reentry and jail diversion programs that we're starting to talk about. In terms of education, we want to conduct monthly education events with 5 key community partners. So far, we've been doing 2 or 3 a month. And then in terms of outreach, we want to continue partnering on 2 community outreach events per week, with the addition of 2 criminal justice events per month. So things like diversion, Mission STL, reentry programs. And we want to host, so far we've kind of been piggybacking off other people's events. We would like to host our own event once per month coming into 2024. And that concludes my presentation. I am open to your questions or comments.
Thank you, Dr. Gary. Do we have any questions? Tim.
Hi and welcome, Serena. So great presentation, Julie. And I'm sort of exhausted by how much work you've done in a very short period of time. So and I applaud the department for Dr. Mahdi and both of you and all of you for taking on this initiative, because I think this is extremely important. As you know, mental health, behavioral health is really key. I probably have a lot of questions, but one question I have is how are there ways in which you're connecting to our partners in the community that are providing mental health, like the universities, WashU, SLU, and others, and so you're doing a lot of direct sort of provision, but I know I can tell you from our perspective, the WashU, there's a lot of concern about this issue. So how is the department connecting on that?
So just to clarify, Tim, are you talking about connecting a patient who's pursuing behavioral health care to, or are you talking about the university itself?
Connect the care. So that, yeah.
Yeah, so we have kind of a list of key partners that we refer people to if they're walking in. WashU Behavioral Health is, BJC Behavioral Health is on our list. So they are an option to connect people to. SLU as well, we do have a connection there. We are also partnering with SLU. Well, we're partnering with WashU and SLU on a couple of things as well. I just met with, for example, the HCRL in terms of understanding like how we're marketing ourselves to the community. And in terms, so we're not only partnering with the universities in terms of like connecting people to care, but also understanding the resources that they have that could help build our capacity or our skill set. So an example with WashU is the HCRL, and Corey, obviously from an equity perspective, kind of helped us frame some of that stuff coming in when he was at WashU. And in addition, when it comes to SLU, we're partnering with them, not only connecting people to care, but in terms of things like training, we're also kind of having initial conversations with the School of Medicine at SLU and Integrated Health Network on the Mission STL reentry program. And so we're kind of trying to overlap and fill in gaps where we see them and partnering in places where we can be kind of that linkage to care person, connecting kind of the academic side to partners in the community that we know would fit the programs that people are thinking about.
Excellent. Thank you. That's what I was figuring.
Excellent answer, Julie. But I will say, Tim, that I'm unapologetic about the academic institutions that have way more budget, way more capacity, and way more resources than we do, being the ones to reach out to us. We do a lot now to link to them. I also serve on the external advisory board, as you know, for the new School of Public Health, where I'm really holding them accountable to having budget, policy, resources, and innovative strategies to assist public health. So while I really love that Julie is doing that, and the next iteration in that is making sure that we are connected with community colleges, academic institutions that are really not prioritized, and leading those are only historically Black college and university. But I will say, while we're on live TV, that it is the responsibility of the leadership at these large academic institutions to support underfunded and increasingly devalued public health. So I do think that while it should be bidirectional, the impetus and the responsibility should be from them to us. So I wanted to take the opportunity to say that too.
Yeah, and if I could say something, I know Kristen's got her hand up. In my other life, as you know, Dr. Monty, I'm in the leadership of that university. And when I'm in that university, I say the same thing. We have a responsibility. And I'm telling them about the work that you all are doing and saying that we need to step up and walk the walk, not just talk the talk. So, that's something we can put on our agenda when we talk. But, I definitely am saying that same thing when I'm at WashU. So I applaud you 100%. I totally agree.
Thanks, Tim. Krista?
Good morning. Thank you, Julie, for all of your hardworking leadership and for your presentation. I just had a question and then potentially a referral that could be useful. My question in terms of Narcan education, that I work at the T, but wanted to just express, are you all incorporating education inclusive of contaminated substances so that people know that there are some cases where Narcan won't be effective depending on what's contaminated inside of their supply? We've happened to see that a lot, and I just was curious if that was a part of your education protocol.
Great question, Kristen. Absolutely. So we understand that in some cases Narcan won't be effective. And so we do talk about that when we're distributing it and holding education with community centers, teams and coaches. We also just, we say it might not be effective. So, you call 911 first, obviously, before you're going to administer. But there absolutely are cases when it's not going to be effective. We also talk to them about testing strips. Not all populations are a believer in that or don't want to take the time to use them. But we do have testing strips on hand and educate them about potentially using that prior to using, not that you necessarily want to encourage using, but so we talk about kind of both of those things. But great question. Obviously, yes, Narcan is not effective in every situation, and people need to know it's not this end all be all lifesaver in terms of their drug use.
Thank you so much for your answer. The second thing is relative to the reentry or your criminal justice pathway. There's an organization that I'm connected to, the Freedom Community Center, that does a lot of incredible work. And I'm not sure if that's one of your partners, but I think it could be an excellent person either to partner with or have them at the table to kind of inform their experience with dealing with the incarcerated and how they approach systems change. Just as a FYI.
Thank you so much. My criminal justice team is pretty new, and they just kind of put together their top 10 community partner list. I know Freedom Community Center is on it, but they haven't met with anyone there yet. So if you have any suggestions on the key people that we should be talking to there, I'd love to get that information.
Absolutely. I'd be happy to connect you to one of their directors.
Thank you so much.
You're welcome. And thank you.
Thanks, Kristen. Dr. Bradley, I think you're next.
Thank you. Hey, Serena, how you doing? You all right?
I'm good. Got on the internet, so I'm okay.
I know, on these internets. Julie, thanks so much. It's always a joy to work with you. I was so excited to see those words in your slide, because nobody thinks that we can talk about compassion and grace and love in public health. So, I'm always really excited about that. I have a larger list of things just because I use the space in that way in case they may be helpful. Always know we can follow up. And then, of course, it's for the board. If there's anything that we see that we could act on, of course, that's why I offer it. One of the things strategically, as far as interventions, I was wondering if you had a chance to think about our social network interventions because of the capacity of your outreach. I wonder if there are some strategies that will maximize your outreach by engaging social network interventions, either with people who have received services or people you're connecting with or something like that. So I don't know if there's something that may kind of maximize your reach in that way. And along those lines, I was thinking, about, and this may be for us as a board, if we've thought about a campaign either through media, like a advertisement, or something on the buses that the city would also be able to get behind and support, where we can just kind of present the heroes of Narcan, so to speak, like, folks, our neighbors who are showing up in these kinds of ways and have found opportunities to do that, just to kind of increase an awareness that there's something that can be done. And if people are ready to take those steps, then they're mobilized to do so. The other piece is thinking about dissemination strategies as you all are planning, and just continue to keep that at the front. I think because my work is dissemination, implementation, research, I think it's so important. The great things that we do, they're not quite getting in the places and spaces that we want them to. So just always, if you could just append a little box on something and say, like, how do we disseminate this result? How do we disseminate this discussion? How do we, every activity that we have, what is our dissemination plan around that? Because I think that'll be really important. For example, the Harris Stowe work, right? How does that how do you take even those products and use them as messaging, as ways, and use them even as an intervention, right? Because you can hear the perspectives of students and folks who are in this space who've had lived experience, and are there ways to be able to use even those insights to tailor your work and your efforts? I'm gonna let it go. I think that's enough. Oh, one more kind of sort of. What are your eyes on the other kinds of structural issues, which you may be addressing through the coalition? Definitely, I know you are. And then if there are any other kind of more precise, pinpointed, the work with the criminal legal system is a really great example. So maybe you've already addressed that in that way, but I know there are other barriers, and wondering if we're able to connect and coordinate in those kinds of ways. Thank you for enduring that.
Okay, where do I start? You know I love you. You know I love you. And you changed your Zoom profile pic. I like that. Anyway, social networks. So I think where we've started with that is we are having peer advisory groups. And so we've had them at 2 organizations so far. So you're basically sitting down and talking to a group of people who are either have gone through recovery or currently going through treatment. And so really get an understanding of what challenges they're having on a daily basis. And then what we're finding is those people are going to talk to other people at that organization who are seeking care, and more people want to talk to us. So Tammy keeps coming. Tammy's my employee that handles the peer advisory groups, and she is coming to me every day saying, so this organization wants to have another one, because people are talking about it so much that people love to share kind of their stories and what's happening kind of in that space. So that's the only social network we've tapped into so far. I feel like it's been good. We kind of have some good themes coming out of that. We do have a campaign. We did have a campaign on the buses. It's inside kind of, as you sit, the ads that are kind of up to your left and right, there were small ads. I would like to look at something larger at bus stops or something like that. I think in the past in St. Louis, I've seen kind of in stigma, things like that. I'd love to use the words grace and compassion in that campaign somehow. And we do have some money to do that. So Kim Vandenberg and I have kind of been talking about possibilities for that. Dissemination strategies. That's something that you and I have talked about a lot in the past, and something that we've been talking about a lot recently in terms of like meeting with the HCRL, the Health Communications Research Lab, marketing us in a way that the average citizen understands kind of what we do and what they can come to us for. And yesterday is a perfect example of kind of that message being passed on. But again, we are constantly thinking about who is seeing us as a resource and why, and how we can add value to kind of the average person who needs us. And so we're thinking about things like, I have one team right now looking at phone apps, because we're not in that space yet, but we know that there's some great websites out there that if I search for help in St. Louis, I get to the right thing quickly. Yesterday, we had someone walk in here who had substance use challenges, but was also homeless. And somehow she knew to come to us. And it's not like we have signage everywhere. So she found us. We ended up finding out how she found us, but it's, getting those other city departments and everyone to see us as a resource. So we are definitely thinking about those things. And I'd love to kind of talk more with you about how we can kind of nail that down as things change, right? Because every day things are changing here. Systems change. So probably the biggest barrier we're seeing so far, well, I'm also on the economic mobility and health CHIP action team. So I kind of feel like I'm constantly having these conversations with community partners that don't just see me as the behavioral health bureau chief. But one of the biggest barriers we're seeing on a daily basis here is the transportation barrier. Okay. And so that is a barrier across not just behavioral health, all areas of health in St. Louis, but it's something that we are seeing over and over and over, whether it's somebody calling in saying, I have an appointment, I can't get there, or it's a community partner saying, I can connect people to this other partner that does this great work, but I can't get them there. And I don't have the money to buy bus passes and so it's a conversation that Dr. Mahdi and I have had in the last couple of weeks about, well, let's just get passes for Metro or whatever, so that we can either provide those to a community partner or hand them to someone who walks in to get them where they need to go. So from a high level, we're thinking about some of those structural issues that have occurred in St. Louis, including things like policies and state policies and city policies that are preventing people from getting the care that they need, whether it's structural racism over time, or it's just a view of an alderman or other politician who doesn't have like a view of grace and compassion on this population. So again, think about it. The volume right now is so high, I don't always get to act on those things. But it's always in the back of my mind, and always that grace and compassion, I always try to keep those words in front of my employees as we're doing the work on a daily basis. I'm trying to think if there's anything else you said, Corey, because you said a lot. Oh, stories. So you talked about stories, and so this is a
Sorry,
Dr.
time. We'll have to connect with Dr. Bradley, but the time for the next
Okay,
agenda.
got it.
Sorry. And I saw Dr. Tepe had her hand up. I hope you didn't give up. Melissa, if there's something else you wanted to mention.
No, that's all right. We can move on. We can talk offline. A big thank you, Julie, to you and your team. And I think the data too, and the conversations you're having are so important, because that will also help you communicate with all of us community partners, right? How we can best continue to improve what we do on a daily basis. And whether that's outreach with you, separate from you in different spaces, or the clinical care, that data is super important. And we will be, not only will you be using it, but we will too.
Dr. Mahdi, are we ending the meeting early?
No.
Item.
No, I'd seen Melissa's hand was up too.
Oh, okay. Are there any other questions for Dr. Gary? So I will say that we do have our first community engagement committee meeting scheduled for November. And I think a lot of what we've discussed here can be on that agenda, specifically around how we support the communications or the public education component that Dr. Bradley mentioned.
Serena, also just, I don't know anything about Robert's rules or protocol, so you tell me how to direct this, but I wonder if folks might be interested in us at some point talking about us maybe either trying to advocate, or if we have resources to commission some work on transportation and health in the city of St. Louis, to Dr. Gary's point. If that is really true, and we're seeing that, and I know it is, and I also don't know the context of St. Louis transportation and those kinds of issues, so I'm sure that's probably its own nest of things. But if it might be meaningful for us as a board to say, like, this is a priority for this city as we think about moving and growing and going forward.
Yeah, I think that's a legitimate question. And when we talk about the community health improvement plan, there are elements of that are a natural fit for thinking about structural issues like transportation. And I know one of the things that I heard Dr. Gary say is that other departments are seeing the Department of Health as a resource for information. And I also know that some of those other departments are thinking about transportation and have funding to address it. So this could be a good opportunity to connect with someone like the city's Office of Violence Prevention, who's also thinking about how they can use their resources to address transportation. So definitely on point for that. All right, so we're going to move to our next agenda item. I appreciate all of the thoughtful and fruitful conversation, and I know we could spend probably even more time on that, so we might figure out how to have like a regular conversation about what's happening with our Behavioral Health Bureau. All right,
Thank
departmental,
you. Thank you so much.
thank you. Dr. Marty, you're up.
All right. So I'm going to highlight a few things, and then we're actually going to try get this report to you a little earlier than usual. So possibly today or first thing in the morning tomorrow. So a few of the highlights you've heard today about the Behavioral Health Bureau's anniversary and some of the metrics for what they've done in the community by the incredible presentation that Dr. Gary just gave. We have been in community teaching. We're kind of back out doing a lot of teaching in schools, community engagements as well, which is rewarding. But what I'd like to kind of focus on today is the respiratory illness season that we're amongst and be able to give you a little bit of key data. So, you know, I have to put my ID hat on a little bit. It's important for people to remember that there's over 50, you know, respiratory viruses out there that folks can get. But in thinking about sort of the triple threats that we've been monitoring for years and that we had a record season for last year, just wanted to talk a little bit about RSV, influenza, and where we are with COVID-19. So for RSV, the big news is I think people have heard that there's now an FDA-approved a vaccine, but it's important to note that there is a distinction between young children, who the recommendation for this season is a monoclonal antibody therapy for infants and toddlers, and for those most at risk becoming sick with RSV, including pregnant women and adults age 60 and older, and then the RSV vaccine, which we believe should be widely available with healthcare providers and in pharmacies within the next few weeks. So please start having these conversations and encourage as you're educating folks about this distinction, that there is both a vaccine and a monoclonal antibody that are used in different settings. We saw RSV much earlier on in the season last year, so it's a little bit more helpful and encouraging to see that it did not come to the St. Louis region as early. However, we're already beginning to see cases in young children, which is the population that we see significant hospitalizations in. And so we are keeping track of that. This fall and winter, we know that we're in influenza season already. If you haven't gotten your flu shot, please do so immediately at your local pharmacy. Or with your primary care provider. So according to the CDC, people vaccinated against flu were 40 to 70% less likely to be hospitalized. And so this is something that's really important from a protection standpoint. We are keeping an up-to-date list of where folks can go on our website. So please share and encourage folks to visit stlouis-mo.gov/vaccines. Our EPI team has just released its first report, and I will share that most recent data with you. But again, we're not seeing the flu season start as early as it did last year, but cases have already started in the St. Louis region, and we expect those to increase in the coming weeks. So COVID-19 is where I'm getting a lot of questions and calls. People are surprised that folks are sick with COVID. We need to remind people that COVID never went anywhere. And they're wondering where they can get a vaccine. So we've tried to be really proactive since the lifting of the emergency order on May 11th, that there would come a time where vaccine would not be as readily available and certainly not for free for all. That time is with us. The CDC has launched a bridge access program that makes vaccine available for uninsured adults specifically. They've prioritized the federally qualified health centers as getting the bulk of that vaccine product. Local health departments have received very little vaccine. We have received, as an example, 100 doses for the entire city in our first shipment. The county just under double that. So we are making it clear where you can go with the different FQHCs who have made that information available to us. So if you see on the screen, Affinia is taking walk-ins and appointments. on Washington Avenue, CareSTL as well, and People's Health Center. So please, again, share that information with folks you know. And if you haven't gotten your booster, please do so. We'd like to thank CareSTL, who are going to be coming to vaccinate our, provide the option for COVID-19 vaccines to our staff and our jail population within the next 2 weeks as well. So I have a more thorough presentation on this. If you would like us to come and educate your entity, if you know of folks who would benefit from a 10-minute or 15-minute presentation on respiratory illness, the data and the resources, we do have a presentation, and you can reach out to me directly as well. Other than that, other highlights in this report.
Dr. Martin, before
yes.
you go to the next slide, Dr. Tepe has a question on the slide you're on.
Mm-hmm.
Good morning. Thank you. A quick comment for folks. RSV vaccine for adults is covered through Medicare Part D, with a little bit through B if needed. So just for your awareness and advocacy, because again, if patients are uninsured, we do not have a way. We've applied for some grants so you see a structural issue here with who is able to get this adult RSV vaccine and who is not. Also, the way the state of Missouri is, when the CDC came out and said that this is a vaccine with shared decision-making with your clinician, patients need a prescription. It's not to say we can't make a standing order for like a nurse to give a prescription in the clinics, but again, it is a barrier to kind of more events with this vaccine and the coverage issue. And we are finding too, we were able to get it for the vaccine for pregnant women. We have the antibody in for newborns, although the antibody we just found out is now in shortage. So we've ordered and received our first shipment, and now we are on hold ordering any more because there is a shortage of the antibodies for infants. And then finally, I would again talk about the messaging. So with the end of the emergency order, people are also just most of the FQHCs are not charging out of pocket for any of these vaccines, but we are needing to collect insurance information, and community and patients are not all understanding of that. And that is because the emergency order went away. So to be good stewards of resources, we need to be reimbursed and use the insurance when we can, so that we can save the uninsured supply for those who are truly uninsured. Sorry, thank you.
That's such amazing information, Dr. Tepe. Thank you so much. It's so important to know, and it's discouraging that at this stage, and it's a prime example of how there's so much more work to do to prioritize and public health is the clear barriers that you mentioned around RSV. So thank you for that. A few other things that I'd like to highlight and bring to your attention. If you aren't keeping track of what's happening with sexually transmitted infections, and specifically syphilis and congenital syphilis, it's so important to understand this. We are working on a regional partnership on a congenital syphilis board with the county around this, but this is a very serious issue. We haven't seen numbers like this in over a decade, and they should not be this high given readily available therapies. So this is something else to draw your attention to. Just shout out to, Michelle Turner, who is now our personnel liaison, and the incredible job we're doing of hiring staff. We're actually running out of space in the Department of Health right now, and I'm advocating for more space in the city because we are hiring so many people. And you should note the number of people left on the month-to-month report is usually 0 or 1. So you should really see that our retention strategies are working as well. So really proud. It was my 2nd year anniversary yesterday of being the director of health for the city, and the retention numbers are really encouraging there as well. I also, it's easy to give bad news. I wanted to give a little bit of good news and draw your attention to this number that, my bureau chief, Justin Hauser, is not the most smiley person all the time, but he's been smiling a lot at meetings when he gives these numbers. You remember I used to be all gloom and doom about animal care and control, telling you how I only had 2 officers. We have 10 officers for the city currently. We have a thriving team. We have a supervisor. They're all getting trained. And so there's still a lot to do to advocate for a better building and shelter because the animals are overwhelmed in that building. But to go from 2 to now 10 officers with some of the challenges around hiring has been incredible. The last thing I will say is we're reaching the end of our reaccreditation process. So Rhonda and Shantae are incredibly busy, incredibly stressed, and them love and support as they get our applications across the finish line. And thank you for those of you who participated, gave comments, are part of the committees. And for job openings, it's so important for you as you're sharing our job openings, of which we have an updated list for you with links directly for folks, that the residency requirement for the city has been lifted. So we could only hire from folks who lived within the city until a few weeks ago when the governor removed that requirement. And so we can hire from anywhere in the region. We can hire in folks who live in Illinois and can travel easily to work. So please, can you make that available? We're hoping to get more guidance about the ability to hire people even more remotely. We're not there yet, but the ability to hire within the region is a huge plus. So please, please make these publicly available. I am now working on an emergent basis to help provide a new care provider for medical care in the jails, as well as to provide much needed oversight and evaluation systems within the jails. More on that at our next board meeting. But those positions will be readily available soon. So please look out for those. But again, make clear to people that they do not need to live in the city. So I will stop there. This will be in your inbox within the next 24 hours or less. But any questions or comments?
I think that's still Melissa's hand raised from the last question. All right.
Just a quick question on the the jails, health in jails. I don't have any other way to describe that. Is that something you've always had, or has that shifted into your purview in a different way, or given some of the recent news coverage and events? And maybe this is I'd be interested to know how we can support you. I just want you to know that we do. And as a board, I think, if you need us to be sure to, amplify that, then I think it's something we should consider.
Yeah, so unfortunately, when I took on the role in October of 2021, was shocked to know that up until that point and up until a few weeks ago, the Department of Health and the Director of Health had no involvement in the medical care of folks in the jail. We had no oversight, and there certainly weren't any of our folks working there. So I reached out to the mayor's office and made my position clear about how we needed to change that, did some research around how other regional and national entities approach that, and what we could do to have a presence so that could be addressed. They were quickly, they did listen. They have supported me now having a leadership role in that entity in the last few weeks. And so we will now be providing oversight to medical care in the jail. The board has already stepped up, many thanks to our chair, Serena, who is providing, who is serving in a leadership role around helping us evaluate emergency proposals for the current provider who will be leaving on November 30th, and who will also be helping us screen and do some targeted recruiting for an RFP that is currently open, and that will be open for 2 more months. And so I have been taking a leadership role there. So we will be formalizing the Department of Health's role moving forward around auditing, evaluation, and oversight of medical care that's critically needed for this population.
Other questions? And I think, Dr. Bradley, to your point, when we have the presentation and fuller discussion in November, we can definitely think about ways that the board could formalize our support for the Department of Health in this new activity and role for them.
Yeah, I think this is a really interesting opportunity, and I'm hopeful about it. So I think we could, yeah, thank you.
All right. So thank you, Dr. Mahdi, for the departmental update. We will move to our committee updates. Tim?
Thanks. Yeah, for the Academic Partnerships Committee, we've been active and we've met 2 or 3 times, I think 3 times now, Craig, if that's correct. And so we've continued to have a very active group, which includes 3 members of the board now, Enbal and Kristen, and then a couple external, and myself, of course, and then Craig is on the committee and a couple outside folks. And on our agenda, last time we met was continuing discussion about the MOUs that are being worked on. I know with our academic partners. I know Washington University. I know there's a current one with St. Louis University and St. Louis, and discussions about Harris Stowe's role. So we just had discussions about the status of that, and making just our support of all that. And I know that's in the leadership's role to push those along. So, but we're very supportive of having those be in place. Another item we talked a lot about was, and I think this will be part of not only the MOUs, but the long-term relationships with the academic partnerships, is making the internships and practicums real, and so that there's a long-term relationship there. And so we've had discussions in all the meetings we've had about how to make that happen, so that this can be more meaningful for both the department and for the university partners. And so we're trying to put our heads around that and come up with ideas. And I know that's something that Dr. Mahdi's thinking about, and so we're thinking about that as well. And then we've also been hearing, we have Spring Schmidt on our committee, who is widely connected in the region and in the state to public health efforts, and she's been giving us reports about what's been going on in the public health efforts across the state. For the public health departments, academic public health departments, and so on. And the final thing I'll talk about, and I don't think this came up in our meeting, but I guess I've been brought into this role in part because of because I'm the vice chair, because I'm in this role. Julie Gary reached out to me, and I'm playing a role in I guess co-chairing the CHIP discussion with her. And so I've been in 2 or 3 meetings on that. And so we've, I think there's a active draft or a near final draft of that CHIP plan, community health improvement plan. So that I've been working with her and her community partners. We had a really engaging discussion of that just this week, I believe. So I lose track of all my meetings. So in any case, that's another thing that we're doing. So that's sort of my report. If you have any questions or comments, I'd love to have them. I'm keeping it kind of short because I know we're busy.
Okay, any questions for Tim? And Tim, I'm assuming when you get those reports on regional or statewide issues, if anything piques your interest as something that we should be thinking about or aware of, you would kind of draw that out and highlight it for the board. You mentioned Spring is kind of talking about initiatives or trends that are happening across the state for public health.
Yeah, that's a great point. And hopefully she'll inform our committee. She'll probably inform Craig or, the department in that. I think everything she's doing seems really positive. I know she's also in discussions with the state too. So, but probably Dr. Motti would hear about that before any of us would. So I think, but I think what she's been doing is talking to other departments. So yeah, for sure, that's a good call out to remind me to let you know or the board know if there's anything that's, that rises the attention. You all should hear about it. So.
All right, thank you. Cyril, are you doing an update for the governance and nominating committee?
Yeah, thanks, Serena. So in regards to that update, we have a list of candidates that's been shared with us. So we're right now working on our time schedule. And once we have our schedule set as a team, we'll enter candidates and then get back to the board.
And are we still taking, or do we still need nominations?
Yeah, if we can get a couple more from the board, preferably we want it by early next week latest, so we can get these schedules appointment.
Thank you.
Yep.
All right. And as I mentioned, the Community Engagement Committee set a schedule of the first Monday of the month at 9 a.m. So November will be our first meeting. And if you're not on the committee, but there are things that you think we should be discussing or considering, feel free to email those items to me. And that includes members of the staff, if there are some things that you want us to really pay attention to. And we'll use that feedback or input to build out our agenda, as well as what we've discussed today. All right, any announcements? If not,
Maybe I'll use this space to announce that next week is the public health meeting for the Institute for Public Health at WashU on Tuesday. And we have a great national speaker, Sandra Kaleo, coming in. And we also have on Monday night, we have Daryl Gaskin from Johns Hopkins speaking. So, and those are public and free events. So, and I know I see several people from the department come, and you're all welcome. Everybody's welcome from the viewing audience.
Okay. Dr. Bradley.
Daryl's a wonderful person and a great scholar, so I'm really excited to hear what he has to say. So I know people are like, you always bringing us work, but that's what we're here for. So I am, I've mentioned this with Julie when we were working on the health equity work, and I wanted to bring it to the board to see how it lands. The guaranteed basic income that was voted right in by our alder persons. I would like to see the Department of Health connected to that project, at least from an outcomes perspective, like to know if health outcomes change for them. And I don't know how we can get in contact with the folks who are designing and leading it. I don't know, yeah. So I've mentioned that. I don't know, Dr. Motti, even if you have any insights about whether there is linkage already there in the process, but I think it's a really good opportunity. We should capitalize on this opportunity to learn and understand what's going on. And you actually may already have evaluators who are doing that. So that's what I'm just kind of checking into.
So it's like you just are in my inbox. The mayor's office did send us these materials today. So we will be helping to amplify this, but I had not thought of getting my EPIs together and working with the mayor's office. They actually have a lot of fellows that they're working with to really increase their capacity. And knowing who's over this, I would not be surprised if they're already collecting this data. So I will reach out to see if they are, and if they are not, or we can increase their capacity, we can see if our EPIs could also do this because I think you're right, thinking about the public health impact would be great. I will include some of these materials and how people can apply with my report to you this month so that you can also amplify and be able to review those. But as part of the packet they sent me, draft emails they have, an email template for outreach has been made available, the timeline to apply, and social media samples have been made available too. So we've all been sent in cabinet this great resource from the mayor's office. So we can work on that.
Remind me, how many people are they trying to reach with this? Like, what's the cap?
Don't know, but I can find out.
So while we have a minute or two at the end, if I could cycle back to Dr. Money on her report. I know we're going to get the long report, but I know you said you're getting a lot of questions about COVID-19, and I think I know the answer to this, but I want to have you say it publicly again. And because I get questions about this as well. We had over 200 cases at WashU, and so people are wondering about what people should know about COVID-19 and how concerned they should be, how they should behave, and what we should be doing in this new sort of period of COVID-19. So if you just got a few comments on that, I'd appreciate it.
Yeah, so this is the presentation that Matt Haslam, who's phenomenal, has put together that we are doing for folks. So on the COVID-19, the section kind of talks about what's happening with cases. We saw record cases in August. Those are beginning to come down, but we fully expect with two of our major holidays coming and us getting into the crux of the winter season, that those numbers will start to come up. We can continue to look at sewer shed data. Just a reminder that on our website, we've updated isolation guidance. Folks don't have to quarantine. We've also put together packets of resources for our schools and have met with them. We actually met with them yesterday. And for schools, we've actually put together a table for when they should start in implementing masking indoors and diagnostic testing using the new metric around hospitalizations. So, shout out to Suzanne Alexander and her team in communicable disease. So this is the real messaging that we are pushing. It's on our social media. We continue to have a COVID-19 dedicated social media day bi-weekly every Thursday so that people are used to looking for it. We monthly can give data as well. So stay home when you're sick. We're encouraging people to cover their coughs and sneezes, avoid touching eyes, nose, or mouth, continuing to wash hands. And we're still recommending wearing a high quality, well-fitted mask, an N95 mask indoors, but especially for those who are at risk, so above the age of 65 or immunocompromised, and then cleaning and disinfecting objects and surfaces regularly. So one of the biggest things that we're seeing is people who are going to work, going to schools when sick. We know that people don't have capacity, and sometimes it's just, listen, I need somewhere for my kids to be. But one of the biggest issues we have is people, increasing transmission by, being in those spaces when they're not supposed to be. We talk about vaccinations and therapeutics for RSV and influenza, but again, I have information around the updated booster and what it covers in this presentation. And then we give you the locations of where to get your vaccine, the websites you can visit to find locations near you outside of the ones that we are promoting, and then where people are still able to get tested for PCR testing. We're also able to take orders for folks who would like bulk N95s or bulk antigen tests. The health department has those available for free. So I just had a day last week where my staff were able to come and get their tests and their N95 masks as well. So I hope that helps with where we're going with the messaging, Tim. And again, I'm available to come and give these presentations for folks as needed.
That's fabulous, and you did a great job. I just thought that was important message to get out to the public at this time. So, and I think the important message is also that it's probably not quite as severe a risk of hospitalizations. I don't mean to minimize it, but it's doing the prevention still really helps. So.
Okay, thank you. If we have no other announcements or updates, our next meeting is November 16th. Look forward to seeing you all then. We are adjourned.
Thanks,
Thank you.
everyone.
Thanks.